Hi, everyone. Today we're going to be talking about Pharmacology Chapter 15, the endocrine system medications. All right. The endocrine system is the body system that helps maintain homeostasis. All right. Homeostasis is when the body is in balance, when everything is working together so that the body can work normally. So, the endocrine system helps the body maintain homeostasis by transferring messages between body systems and organs to keep both of those working efficiently. The endocrine system has the following functions. Make sure you are listening. The endocrine system helps the body use energy. It also regulates temperature when the body sleeps. And it also assists the reproductive organs by allowing the right amount of hormones to be excreted for reproduction. Medications are most frequently used to suppress or lower or replace those hormones normally produced by the endocrine glands. All right. Now, the endocrine system uses chemicals known as hormones. They act as messengers to various parts of the body to trigger a reaction. Several components make up this system, all right? If you look in your pharmacology book on page 264, figure 15 1 gives you some of those components, okay? Which are controlled by something called the hypothalamus, all right? Now, the hypothalamus gland, you need to know, is located in the brain, all right, in your brain. Then it secretes chemicals called releasing factors that trigger the release of several hormones from our pituitary gland, all right? Now, the pituitary gland is also located in the brain, like the hypothalamus, but it is known as the master gland because it secretes most of our body's hormones, all right? So, the endocrine system, you have learned, houses so far two components. The first one is the hypothalamus gland, all right, which is located in our brain. It secretes chemicals called releasing factors, and these trigger the release of several hormones from our pituitary gland. And then you also learn that the pituitary gland is also located in our brain. However, it is also known as the master gland, okay? Because it secretes most or majority of our body's hormones, okay? The pituitary gland secretes follicle stimulating hormones, or the FSH hormone, and it also secretes the LH hormone, or the luteinizing hormone, which are both important to female reproduction. And it also secretes the ADH hormone, or the antidiuretic hormone. This hormone helps to prevent loss of water by our kidneys, all right? In addition to that, the pituitary gland also secretes the hormone TSH, or thyroid stimulating hormone, which this hormone then triggers thyroid gland function, okay? Now, if you come on over to page 265 in your farm book, you can look down below at table 15-1 and 15- and figure 15-2. These provide a more in-depth look at all of the hormones secreted by the pituitary gland. Remember, that's our master gland, the pituitary gland. It secretes the majority or most of the body's hormones, okay? So it's secreted a lot of hormones, all right? Now, you also have something called the hypothalamus, all right? This is what we call our body switchboard, okay? The hypothalamus tells our pituitary gland, or the master gland, which hormones to send out to the body, all right? When a hormone level becomes too high, the body tells the hypothalamus, and then the hypothalamus tells the pituitary gland, or the master gland, to stop producing so much of that hormone, okay? This is what we call a negative feedback system, okay? Now, all right, if you look on page 265 at figure 15-2, the pituitary gland, and the hormones and their target glands. This kind of gives you a great visual of what we're talking about with that master gland, pituitary gland. Now, come on down to the bottom of that page on table 15-1, okay? And this is going to give you a list of hormones on the left, okay? It's also going to give you their target organs and the effect that that hormone has on the organs. And then it's going to tell you what overproduction of that hormone would cause, and then what underproduction of that particular hormone would cause, okay? I suggest you all take a really, really good look, make some note cards, some index cards on these hormones. I'm going to review them with you, okay? The first one is called ACTH. This is the adrenocorticotropic hormone, okay? This regulates the release of epinephrine and glucocorticoids in our bodies from our different adrenal glands. This determines something called the fight or flight response to our autonomic nervous system, okay? And now overproduction of that hormone ACTH, or the adrenocorticotropic hormone, could cause a disease called Cushing's disease, all right? Now, underproduction of this ACTH hormone could cause Addison's disease. Make sure you guys are reading and making index cards, or however you study for these tables, all right? Very important in your pharm chapters. The next hormone is called the thyroid stimulating hormone, or TSH, all right? This hormone regulates the release of hormones in our thyroid, which affects our energy if we have too much, if we have not enough energy, okay? Overproduction of the TSH, thyroid stimulating hormone, can cause a disease called Graves' disease, okay? Underproduction, or not enough TSH, thyroid stimulating hormone, in our body could cause a disease called myxedema in adults and creatinism in children, okay? We've got another hormone called somatotropin, or the growth hormone GH, okay? Both of those terms are interchangeable. Make sure you know that. All right. The growth hormone, or the somatotropin hormone, this regulates the growth of our bones and our muscles and other tissues by affecting our liver and our adipose tissue. Adipose tissue is fat tissue or subcutaneous tissue, just FYI for you, okay? Overproduction of the GH, or growth hormone, can cause gigantism, all right? This is an abnormally tall stature, or a patient becomes almost as tall as a giant, okay? But underproduction or lower production of this growth hormone, the GH hormone, or the somatotropin hormone, can cause a disease called dwarfism. And this is abnormally a short stature. So you're really abnormally short, not like the regular short, abnormally short, okay? And the treatment for this would be more growth hormones, okay? These people are going to need more of the GH hormone. Then we have another hormone called prolactin, all right? This stimulates milk production in our mammary glands, all right? If you've ever had children and you breastfed your children, this is what makes that milk production in our mammary glands, the prolactin hormone, okay? Overproduction of this hormone, all right? Overproduction of breast milk in women, all right, can also be a sign of a pituitary tumor, all right? However, underproduction of prolactin, or underproduction of milk in women, makes it very difficult to nurse our little newborn babies, okay? Make sure you guys are reading this chart, okay? Now, we also have the follicle stimulating hormone, or the FSH hormone. This stimulates sperm production in men and the egg production in women, all right? And overproduction of the FSH, or the follicle stimulating hormone, can cause increased fertility in women. However, underproduction of the follicle stimulating hormone, or the FSH hormone, can cause sterility in men. And in women, it can cause irregular or absent menses or irregular menstrual periods or not even having a menstrual period at all. Okay. Now we have the luteinizing hormone, all right, or the LH hormone, okay? This stimulates the release of the ripened egg in women, which is called ovulation, all right? This also helps in the production of female hormones, okay, like estrogens and progesterones. Make sure you remember those are female hormones only. Men do not have estrogens and progesterones naturally in the body, okay? Now, overproduction of the luteinizing hormone LH could cause multiple gestations in pregnancy with women, such as twins or triplets and things like that. And then underproduction of the hormone LH or the luteinizing hormone can cause infertility in women. All right, which means that women can't ovulate and therefore they cannot conceive a baby. All right. Now, we also have a hormone called the ICSH. This is the interstitial cell stimulating hormone. And this hormone stimulates productions of something that we call androgens. All right. This is the male hormone testosterone. So the ICSH, which is the interstitial cell stimulating hormone, stimulates the production of androgens or testosterone hormone in males, all right, or men. Now, an overproduction of the interstitial cell stimulating hormone or the ISCH can cause aggressiveness, all right? It also can cause excessive hair to grow, okay? Now, underproduction of the ICSH hormone can cause feminine attributes in men, such as a higher voice in a male, all right? Or small muscles in a male, okay? Now, we also have a hormone that is found in the back or the posterior of our pituitary gland. Remember, posterior means behind or back, okay? And you have that antidiuretic hormone. This is the ADH hormone, all right? This hormone conserves fluids by changing the permeability of our kidneys, okay? Now, overproduction of this hormone could cause a syndrome of inappropriate antidiuretic hormones, such as SIADH, which means it is syndrome of inappropriate antidiuretic hormone. Basically, it means there's too much fluid being retained in your body, all right? And the treatment would be diuretic medicines, all right? They would be, diuretics are water pill medicines. They're going to make you secrete that fluid off your body by urinating frequently, okay? Now, underproduction of the ADH or the antidiuretic hormone could cause something called diabetes insipidus, all right? Listen up. Diabetes insipidus is too much fluid. This happens when too much fluid is excreted by your kidneys, resulting in the body becoming dehydrated, okay? Make sure you guys read this table on page 265 and 266, table 15-1, okay? Make you some note cards. Know those hormones. Know their function, the target organs, and their effects. Know what happens for overproduction and underproduction of those particular hormones, that I just went over, okay? Now, we are going to come on over to page 267, all right? And I'm going to talk about a couple of things on this page. We touched a little bit on the fight or flight response, okay? I want to talk to you about something called calcitonin, all right? Now, that thyroid gland that we talked about earlier, which is located in our neck, all right? It surrounds our esophagus and it regulates our metabolism, including it regulates our temperature and our body weight, okay? The thyroid gland also regulates blood and bone calcium by secreting something called calcitonin. All right. Calcitonin, I want you to know, helps to force calcium ions into our bones. It forces calcium ions into our bones. Okay. If a patient has insufficient or low or not enough calcitonin in the body, the blood calcium level remains high and the bone calcium level remains low, thus leading to more bone fractures, okay? And then something called replacement hormones help with both energy and calcium storage, but the prescriber may only order calcium supplements for these patients, okay? Now, I also want to talk about we have four parathyroid glands, okay? These are located on the surface of our thyroid gland, on the top of that thyroid gland that's located in our neck, that surrounds our esophagus, okay? And these four parathyroid glands are responsible for the concentration of sodium and calcium in our blood and our urine, okay? The parathyroid glands, which are embedded, they are embedded, that means down deep in our thyroid gland. These also help regulate our calcium balance. They counter calcitonin with something called a parathormone, all right? This parathormone pulls calcium out of our bones and into our bloodstream, okay? Now, I want to skip down to the next paragraph and I want to talk more about that fight or flight with that ACTH hormone, that adrenocorticotropic hormone. The adrenal glands, I need you to know, are located just above your kidneys. Your two bean-shaped kidneys both have adrenal glands located just above them, all right? And these adrenal glands secrete that ACTH hormone or the adrenocorticotropic hormone by the pituitary gland or the master gland that stimulates the release of cortisol and glucocorticoids to control our fight or flight response, okay? So our fight or flight response is the automatic reaction that prepares our body to flee or to run or to stay in attack, okay? An example, if you were inside of the school building, of MTI building, and that building happens to catch on fire, okay? The fight or flight response from your ACTH hormone would kick in. Either you're going to stay in school and burn, or you're going to fight to find a way out to survive, okay? Now, the fight or flight response is the automatic reaction that prepares our body to flee or to stay in the face of some type of attack, okay? Now, the outer cortex of our adrenal glands secrete something called cortisol. This helps maintain our blood pressure and our cardiovascular function, okay? It slows our immune response of the body and it helps us to maintain steady sugar or glucose levels, all right? Through that negative feedback system that we talked about in the beginning of this lecture, when the cortisol level increases, our hypothalamus, all right, then tells that pituitary or that master gland to shut off that release of that adrenocorticotropic hormone or that ACTH hormone, okay? Now, there's another gland that I want to talk about, and it's called the pineal gland. We're still on page 267 here, all right? This gland is located also in our brain, and it secretes something called melatonin, all right? Okay, it secretes this melatonin in response to input from our eyes, okay? The more light that enters those eyes, the less melatonin is released. Melatonin is what helps us to get to fall asleep, to be sleepy, all right? Thus, in the darker hours or during night and in wintertime, we tend to feel sleepier. When the pineal gland fails, sleep is impaired, and melatonin or barbiturates, all right, may be prescribed to correct the disorder, all right? Now, your book tells you on the bottom of page 267 to see that master the essentials table for descriptions of the most common endocrine system drug classifications. So that's what we're going to go over. I suggest you listen up, make some note cards, Be very specific, okay? Um, you're more than likely are probably going to have a matching section on your exam with these medications, okay? So we're going to go over the master the essentials in endocrine medications table here at the bottom of page 267. All right. This table shows the various classes of endocrine medications and the key side effects, the contradictions and the predictions and the interactions